Paul Maskey, why are you here today?
Well, first of all, as the MP for West Belfast, I'm here to support many of my constituents who are employees in the Royal Hospital behind us here. We demand a fair day's pay for a fair deal's work, and I think that there's been 4 years now without any pay increase, and I think it's unfair on the staff who have worked tirelessly, and we've seen it on the news and we've seen the conditions that they have to endure when they're at their work. Whether that's in A&E or any other part of the health service, they are very hard working and very committed and dedicated to their job, but their pay salaries don't dictate that, and I think that's wrong, and I think that Evan Poots again needs to be putting proposals to the executive to say that these workers deserve a fair day's pay for a fair day's work. As Sinn Féin goes, we have constantly raised this issue of the health workers. Maeve McLaughlin, who is the chair of the Health Committee, has raised this on many occasions, and she's raised this with Evan Poots over not only recent times but over a number of years now. My party colleagues on the executive has raised this as well, and we have raised this at a council level, so at every single level across the way Sinn Féin is raising this and pushing this, because we demand respect for workers. We want to see our workers in the health service and any other who are doing a really frontline service are getting a fair day's pay for a fair day's work, and I think that's imperative of all the parties to do the same, and that's why we will raise that at every single level, whether it be in council, the assembly, or myself when I visit to Westminster to raise it with other parties, political parties over in Britain.
Well, health service workers across the NHS are out today campaigning for a decent pay rise. They've been offered here nothing as yet. The rest of the UK they've been offered 1% or less than 1%, and it's a derisory pay offer that sees our pay cut over the last 4 or 5 years by up to 17%. And workers are now saying enough's enough, it has to stop.
On top of that, I believe there are ongoing problems with actually getting paid.
Well, there's another issue in Northern Ireland. The computer systems they put in aren't fit for purpose, and essentially they're causing numbers of people to go without full pay each week and each month, and it hasn't been resolved. 7 months it's been ongoing now, and again there has to be something done. The department put in a shared services project to save £120 million. It must be costing that to repair the damage it's done.
What would be your message to Minister Poots?
Look at the real problems in health, look at the real places where he can save money, and look at paying the members and the workers that need the right pay for the right work, and get it right, Mr. Poots.
Jennifer Cam, what's your take on why these health workers have had to come out and strike today?
Well, I think that they're here, first of all, and can I say I'm here to show our support for them. They're here, first of all, because of the debacle that the health workers have been getting in their wages. We've listened to it on our television and we've listened to it on our radio. And I mean, it's ridiculous that people who are going out to do a day's work and then aren't getting the money for that day's work. It wouldn't be tolerated anywhere else. So that's the first thing. And the second thing is obviously they're looking about the pay raise, and again I'm here to support them for that. I mean, our health workers do sterling work. We couldn't do without them, and I believe that the people should be out supporting them today.
Who's to blame? Where does the blame lie?
Well, in my opinion, the blame lies with the minister, because in the end of the day he's responsible for the health workers, their overall the overall sort of health worker sector. And in the end of the day, I mean, we have raised this as a party. We have raised this consistently through our health spokespeople, but we've also raised this here at the executive level as well. So I mean, we're saying that basically it is an appalling situation when people are out working, ordinary people, working class people are out working, given a sterling service that we couldn't do without, and at the end of the month they're not getting paid. They're not getting paid the amount of money that and then people have mortgages, those people have childcare costs, they have food to put in their tables, they have heat to put in their homes. So we're saying this shouldn't be happening in the first place, but it needs to get sorted now.